that's what people are used to practicing medicine the way that they've been taught to practice medicine. And you just get in that rut and, oh, well, this is just how you treat this disease. That's just how it is. And until all my colleagues tell me, oh, no, we want to do this differently, they just basically toe the line. And unfortunately, a lot of doctors practice guideline medicine as opposed to evidence-based medicine. Evidence-based, one doctor in a book wrote a book called Better. He also wrote Complications and other sorts of books. A guy named Dr. Atul Gawande, who's a professor of surgery at Harvard, and he's at Brigham's Women's Hospital, or at least he was. And he's specializes in oncological general surgery. So he'll take out, different sorts of adrenal tumors and things like that. And so very good writer, very interesting guy. Wouldn't necessarily agree with everything that he's concluded, but excellent information and excellent, very interesting. Funny enough, the first season of Grey's Anatomy, like all the medical stories and things came directly out of his first book, Complications. I mean, like word for word. And I was like, they better paid that guy for that, because they just robbed his book. It's an interesting guy, very interesting stories, and very, very good writer. And he wrote about a doctor in that his second book called Better that treated cystic fibrosis, and he had very different outcomes, and he did very different things, and he had he had the best sort of outcomes and best rates of treating people with cystic fibrosis. He had a patient who's like 63 and symptom free, well, essentially, living a normal life at 63 with cystic fibrosis. A lot of people die in their 20s from cystic fibrosis, or 30s or 40s. It's a very, very serious disease, and he was having much better outcomes, and he was doing things that were different than the evidence based. You should do this, that, and the other. And Gawande asked him. He just said, he's like, okay, so you're doing something different than evidence based medicine. Why is that? And the guy sort of like smiled and smirked and just said, if you follow evidence based medicine, you'll always be 2 years behind the cutting edge. And so he was the one making the evidence. He was the one trying new things and making the new evidence-based protocols for other people to follow 2 years down the line in his footsteps. So that's evidence-based medicine. If you're practicing evidence-based medicine, you're going to at least be 2 years, because you're doing something. Wow, this worked. Here's the study. Takes 2 years, get it published. Okay, that's in the evidence now. Okay, so you're going to be 2, 3 years, 4 years behind the curve, behind the cutting edge. Then guidelines, though. Guidelines are a bureaucratic mess. And sort of every 5-10 years, they'll come together and relook at the guidelines, and they'll say, okay, here are the experts in the field. Give us what you think is the best evidence. And they'll take that, and based on their own personal predilections or their financial conflicts of interest with different industries, they'll just make whatever guidelines that they want. And so the guidelines are not evidence-based, and they're generally 10 to 15 years behind evidence-based medicine, right? Because they only come around every 5-10 years. And then how much can you get in there of the current literature? So they're way behind. And so, and they're biased, frankly. And so I've spoken to people that say, well, this goes against the guidelines. It's just like, right, but it goes with the evidence. This is evidence-based medicine. And they're like, oh, you can't go against the guidelines. You can't go against the guidelines. So it's like, well, what if the guidelines conflict with the evidence? No, I will never not follow the guidelines. I'm like, okay, well, the guidelines are there as a guideline. It means that you don't know what the hell you're doing, and you're not confident in your practice. And so you need to be babied and spoon-fed in your practice. That's what following the guidelines is. And it's a good structure, and it protects you, because, well, I followed the guidelines and it killed 50 people, but they followed the guidelines, like, fine, that protects you. That's a CYA practice, cover your ass sort of medical practice, but it's not necessarily the best thing for your patients. And so guideline, I've spoken to people that said, well, this is the evidence, and this is the evidence-based medicine. They're like heads of department, even people in a position where they should know better. They said, I don't practice evidence-based medicine. I practice guideline-based medicine. It's like, well, then you should lose your license, because that's a really bad thing to do. And it's going to be 10, 15 years behind the cutting edge, So it's something that I believe is going to keep changing, but if you want to get something new, you have to try something new. If you want the same results, and keep doing the same thing. But if you're unhappy with the fact that we're getting fatter and sicker than we've ever been in human history, then you obviously need to try something new. And we're getting different results. And I think that's the important thing. And I think a lot of people are seeing that, and they are seeing that people are getting dramatically better. And it goes against the guidelines, and it goes against, what they've been told and taught, but it's happening and it's true. And that's the only thing that matters. And which is why more and more people are coming to this. And I get more and more doctors contacting me saying, wow, I just came to this, and like, this is something that I want to do, and I've done for myself, and I've done for my patients, and this is amazing, and I'd like to learn more about it. And then patients saying that, they go to their doctor, and their gastroenterologist is saying, hey, the best thing for you to do is go on a carnivore diet. That's going to be the best thing for your Crohn's. It's like, wow, that's amazing. So it is happening, because you cannot ignore the real world outcomes and facts forever.